Okay, this is the thoracic sequence. First, you test thoracic side lying rotation. So the patient lies on their side, hips and knees bent to 90 degrees. Put your hand behind the top leg, proximal tibia, and then tap their scapula and have them try to touch this to the table. Normal would be this melting to the table, right? So this is about 50% of the range. Now we're going to do the thoracic sequence. The first two things are piriformis inhibition. Piriformis muscle runs this way, so you're just going to pull your fingers and thumbs together. This is moderate pressure. If I stand lining myself up with the femur, then I know my hands are in the right direction. Okay, so you don't want to be here. You want to be lined up with that femur. About 7 to 10 seconds here. Then take your knuckles or the heel of your hand and in one direction release the fascia around the IT band and the vastus lateralis. Okay, so piriformis inhibition, and then release the IT band, and then recheck the range of motion. See, this is a lot better, so her restriction was primarily at the hip. And we're going to go up here to do thoracic nags. Here's the hand hold. Pretend like you're shooting a gun. Drop your thumb down 90 degrees, and it is the middle phalanx and the flat side of the thumb that are going to be applied to the transverse process. The spinous process is going to be in between. So starting around T2, I'm pushing in. I'm holding it in, and then I'm gliding up towards the eyeballs. This is what it looks like. Find a spinous process, split your fingers. You know your fingers are on the transverse process if there's about an inch of space in between. The biggest mistake students make is to be in too close. So I'm going to do thoracic sequence all the way down to about T8, which is the bottom of the thoracic kyphosis. Notice how my arm is in line with my wrist. This gets a lot harder if your wrist is bent this way, so keep your wrist straight. You can also see how I'm using my body to push and apply the distraction, the anterior push. So this is an anterior superior glide. All right, once you go down and up, then you can do the posterior rib mode. So you want to stand, I'm going to swing around. So you're going to stand now lined up with her arm, the hand that's closest to the hip. If you put it on the rib cage, you'll be able to do this posterior rib mode. Now, here's the spinous process. If you palpate, there's going to be a little divot, then the roundness of the paraspinals, and the next kind of bony bump you feel is the costal angle, and that's where you want to place the heel of your hand. The ribs angle down at a 45-degree angle, and so I'm trying to move the rib cage this way, right? So with the heel of my hand, doing a grade 4 rib springing. I have room for about 2 or 3 hand positions because you're getting 2 or 3 ribs under each one. Okay. And then from here we do the latissimus, we call it the lat squeeze, but it's really a fascial mobilizer. So you're not grabbing the muscle, you're grabbing the skin over the muscle right here in the posterior armpit area. And I am just alternating, grasping, using a lumbrical grip. It's much more comfortable to the patient if you use this grip versus this. Okay, and then the last 2 parts of the thoracic sequence. This usually clears it totally, so I usually test it again, roll that shoulder back. If it's still not clear, then you're going to add the last 2 parts of it, which are done in the front. So the next thing is pec minor inhibition. So the pec minor runs from coracoid process to ribs 3 through 5, so I'm going to inhibit here, pulling my thumb and fingers together. And then the last thing I do is an anterior rib mode. This time I'm using my hand closest to her head. If I'm standing lined up with her shoulder here, I can place the heel of my hand, the thenar eminence, edge of the thenar eminence, on the sternum, slide off of it a little bit, and then I'm just doing grade 4 oscillatory pull up towards the shoulder. And that's it. That's the thoracic sequence.